Trying to get this all going. Try to fire up all these outputs, bro. I think we're live on all, I think, but I have actually no idea. So anyway, back to the game. We're here gaming. We're answering skincare questions. You're fortunate enough today to have two great dermatologists here, Dr. Chris Tomasian and myself. So if you got any questions at all, feel free to ask. So any questions at all, bring them on. We're here to help you get your best skin. So anything you got, formative, Shruti, thanks for being here. Tell me about Nimluvio. So you asked me about that, that new. So Nimluvio, IL-31 blocker, really effective for itch. I'm getting a little bit of mixed kind of signaling though from some of the derm community. Some people feels like it's helped them. I've got a couple people on it for prurigo nodularis, which is kind of a disorder of really itchy skin that causes these thick bumps on the skin. So but yeah, I don't know, Chris, have you used it at all?
Yep, I use it quite a bit. Works pretty well. I mean, I think Dupixent's still better, but I'm red threat, by the way.
Okay. I mean, we're pretty close. You're upstairs though?
Yep.
Okay. So yeah, I haven't used it in eczema yet, but I've used it for prurigo, and the one person I have it on actually is doing really well. So the one person I have it on is actually doing really well. And it's also been pretty easy to get it, which I think is a really nice thing. Hey, Anna, thanks for being here. It's good to see you. I got Dr. Tomasian on here today, too. So.
What's up? What's
yeah.
up? Oh, shit.
Sure, yeah.
How do you die? How do you die? How do you die?
Two on me. Yeah. So, yeah, a little bit of a crew today. So thank you guys so much for being here again. I appreciate it. Oh, you heard him. Yeah, you know that guy's voice, don't you? Yeah, you know.
How long till you go?
Let me see here. It says prepare to fight, so let me see.
Fuck.
What's the best cleanser you can use? I'm a huge fan of CeraVe cream to foam cleanser, but I also like Rock Barrier Renew gel to foam cleanser. Went down pretty rough there. So I like both of those a lot. There's a lot of good options out there. Thank you guys for tapping the screen. Pat the cat, good to see you here, and glad to see that you can actually see my live stream today. Vitamin C recommendation. Really think the best Brandify. You beat me to it, man. I think when you look at affordable and effective together, Brandify is like really it. Brandify is fantastic. So really like Brandify. Diet, how much does diet affect psoriasis? Alcohol and being overweight can affect psoriasis. There's people out there that would probably encourage you to Mediterranean diet and that kind of thing, low inflammation diet. But even if you do everything perfect from like a diet perspective, it's probably not gonna like make it or break it with psoriasis. Sometimes you're just gonna need, effective prescription treatments. So thank you guys so much for tapping that screen, guys. If you guys are here, again, Dr. Dylan Greeney, board certified dermatologist, here to help you get your best skin. Got Chris Tomasian on with me too, another great dermatologist. So thank you guys for being here today. How are we feeling? Is it safe here?
It's good right now, I think.
Okay. Thoughts on JAK inhibitors for alopecia? I've got a few people on JAK inhibitors for alopecia, and they're doing amazing. They're young gals. They were probably 60-75% bald, and now they're doing so much better on JAK inhibitors. I cracked him in the front. Is he out? No, he's still in. I got a thermite too. So far. Will it hit? No. Oh, they're in the back. Are you getting out? No, come on. Hey, what's up, guys? Thank you guys for being here. Again, Dr. Dylan Greeney, board certified dermatologist. Appreciate you guys being here today.
Wow, we suck at this game.
It was kind of what I call it, like almost like a warm-up, Dr. Dodia, what's up?
Aggressively over there, thermiting from 500 feet away.
I know, and I overthrew it. I've got an arm on me, man. What can I say? I overthrew it.
You're SwoleMD, bro.
Yeah, SwoleMD is right. I'm living up to it today. The derm or plastic surgery for moles. I mean, I think we're both biased, but I would definitely say derm. You know, I do mole removal on the face, the body. I like doing a lot of laser removal on the face. Like actually, one of my recent stories I had, I was doing one of those, so it was really helpful for people. Been loving Rhodes Pineapple Enzyme Wash, alternating that with Remedy. I actually haven't used a lot of the Rhode products, so I know it's a wonderful brand, hear good things about it, but I haven't really used it much. Poison ivy 2 months ago and it still itches. Oh man, it's one thing to get it for, you know, 3-4 weeks, but going on 2 months, that's crazy. So just make sure you're taking good care of your skin, you know, barrier there, Vaseline, a nice heavy moisturizer, CeraVe moisturizing lotion. You can even use something with permoxine in it. You know, and are you sure it was poison ivy? You know, Seth. Could have been something like shingles, you know, and it's kind of changed the nerves there maybe. I like Sarna Sensitive in the fridge. That's a good one. Ashley, good to see you again. Thanks for hopping on last night. It's a pleasure to see you today. Did I mean to go live on Twitch too? I did. So I got them actually live on both. And if there's any like, you know, real ones in the chat, actually, if you could tell me if I'm live on UT horizontal, if I'm live on UT vertical, Twitch, let me know about all that, because I actually am curious and I feel like I don't have it set up like properly to really look at all that. I'm trying to figure out how to turn the preview off of this. Table preview. I'm balding at 23. What do I do? Chris, what do you think?
Minoxidil, finasteride.
Yeah, minoxidil and finasteride, and both are, you know, you have topical options for both. Topical options are going to be more expensive and kind of more of a pain in the butt to use. But if you're looking at what the best thing you can do, is going to be oral minoxidil and finasteride, or dutasteride. But dutasteride is going to have a higher risk of side effects. So, and what side effects we talking about when we talk about that is really things like, you know, decreased sex drive, and fortunately it's still pretty rare, you know, it's like not super common to get those issues, but it can happen. I already use Finacea and Taz daily. I like the combo Finacea and Taz. So with the Tazarac, obviously you're going to get great, you know, anti-aging and acne benefits. The Finacea, good if you have some rosacea, possibly even if you have a little bit of hyperpigmentation from your acne. But if that's not cutting it for your routine, you're going to be looking at doing things like Accutane. Vitiligo for 30 years. I've actually got a few patients that were like depigmented for most of their life, and I got them on topical JAK inhibitors, and they repigmented most of their skin, believe it or not, which is crazy.
How much body surface area do you do?
Well, I guess the correct answer would be less than 10, right? But have you heard that whole controversy?
Honestly, I just say I go like up to 30.
So I mean, yeah, this lady was very depigmented. She probably did have like 30, 50, something like that, but she just really wanted to repigment her chest and her neck, and so we were doing that. Can I use vitamin C with Finacea? Tazarotene, is it too much? You know, some people think vitamin C breaks you out. Vitamin C is a little acidic. You know, it can be sometimes irritating in people, but most people could tolerate these things, no problem.
Did you get your load up?
I did. I went over in the street and grabbed it. Yeah.
Just go let Chris die on his own out there.
Oh, sorry. Here, I'll go. So
go for it. Going down. Don't follow me. Don't follow me.
Just watch it. Is Dupixent good for eczema, Chris? What do you think?
It's the best.
It's the best. It's the best. BESSSSSSS. It's the best. GHKCU.
It's really good.
Go ahead.
No lab monitoring. It's really nice. Patients like it.
It's safe. It's effective. It's approved all the way now to babies that are like 6 months old.
6 months, yeah.
Yeah, which I can't even really imagine the circumstances needed to use in a 6-month-old. But
the needle goes through them.
Yeah, I was gonna say it's itsy bitsy then, man. Play zombies. Jill, we're on here. We gotta play this competitive. Actually, I haven't played zombies in a long time, but that would be fun. It's fun.
I'm thinking we hit there because I think there's a team here.
Okay, down.
Thoughts?
Let's see. Down. GHKCU. I mean, have you seen? I get questions about this all the time now. I don't really know much about it. You know about it?
I
don't know about
it. What is it?
I don't know if it's like a peptide thing that people are doing, but like I get asked about it every time I'm live, and I don't know if it's
sounds like a peptide.
GHKCU, copper. I don't know. Yeah, peptides are buzz right now.
Right.
Peptides are all the buzz right now.
Broke.
That should have hit, bro. Ooh, I'm getting hit from a different angle. Probably kind of like over by the ammo crates. GLP-1 for HS. Would you prescribe it during gyno primary? GLP-1. Honestly, primary probably going to be more for like obesity. That's what they're going to get it indicated for probably, or diabetes, that kind of thing. But there are some derms out there that are getting into like the wellness and longevity space, and they're doing things like GLP-1s. Thoughts on double cleansing? I think if you have a good cleanser, you really don't need to do that. I think it's doing a little too much personally. I don't think it's like necessarily harmful, although there are some studies to show that you can have some increased acne with double cleansing. But I think
most of the time it's fine.
Yeah, most
especially oil cleansers. I feel like it's pretty gentle. Just don't only oil cleanse. You know.
What are peptides best used for? Well, they can be the cherry on top of any good skincare routine. But I particularly like peptides for people that like, you know, they can't tolerate the typical things like retinol. So if you know that your just skin is so terribly sensitive and you can't really use much else, then peptides give you good, you know, anti-aging benefit. Do I like regular Fudex or do I like it compounded with calcipotriene? It's kind of rare for me to write for Fudex with calcipotriene. I sometimes do it when people like really say they got no effect from the other formula. So
where are we going here? Let's take this car
down
moving.
For what? Anywhere. Need to like. Yeah, I'm ready. We go to that. I have a UAV too. You going to the car?
Yeah, I mean, there's some boxes in here. On here.
22 with acne still, and that's unfortunately pretty common to still be dealing with it.
Hop in.
Yeah, okay, I'm coming.
We're going shopping.
Okay, let's go shopping. Can you get a perm on Accutane? Yeah, I don't think that's any trouble.
Yeah. I actually let some of my I let patients even go on do some surgeries on Accutane now.
Oh yeah, they do. Okay.
Like minor stuff, you know.
Look here. Don't know. Does
You're just hanging out in the car?
No, I'm out now. I'm sorry. I look at my thing. Can anybody say like, is my other stream like working? I don't know. They removed a sweat gland tumor. Should you be worried? I feel like it just kind of depends on what exactly that is. Yeah. I mean, because there are a lot of things that come from different adnexal structures in our body. Sweat glands, oil glands, stuff like that. And some are benign and some are malignant. but you're in good hands if you're seeing a dermatologist and an actual board certified dermatologist. You're in good hands. They'll usually bring on, you know, additional teams if there's something else that needs to be done. Panoxyl, is it good for acne? It's fantastic. I like the 10% for the chest and the back. They do make a 5% for the face, which is good. Appreciate you, Ike. You the man. Best firming eye cream for under eyes. There's two I like. I like Brandify Retinol Eye Serum, which I actually have here on the desk because I was in it. Yeah, check out the other platform too with a T, Anna, but I'm glad YouTube's doing good. I don't know if that's focused up, but that's Brandify Retinol Eye Serum. Another good one would be, I like Versed Smooth Landing Retinol.
Coming from behind us.
Behind. Okay.
From like this end of the thing.
The direction you're going?
Yep.
You want a UAV?
Nope. They have loadout right here.
Okay. Go firehouse. Been getting burned from adapalene. Any advice?
Right here. Use left.
Advice on that is just like back off of it, start super slow, no more than a pea-sized amount every 2 nights.
Top.
Yep, watching top. Oh, they're watching me.
Shit.
Yeah, they know me. Oh, precision.
Oh fuck.
It's over,
sorry,
brother.
Bro.
It's over, brother. I'm gonna try to go off the edge and maybe no, ain't gonna help me. How do I get wounds to stop weeping?
Don't worry, don't. That guy just smacked you though, Jesus.
They did. They smacked me bad. So sad about, yeah, so Twitch isn't working, but so thank you guys for the feedback. Audio is good. Gotta figure that out. Yeah, he did. I didn't even say glint, so I don't know. Does DIM actually work for hormonal acne? I don't know if I can pronounce it. Diazoxymethane? I'm actually not familiar with that. Best for scarring. Lasers, you know, lasers are probably going to be the best, and there's a combination of ways to do that, but you got to do all kinds of stuff, you know, sometimes injectables, lasers, peels, microneedling, subcision. Every acne case is or scarring case is a little bit different. You need a use or an emote for Twitch. I mean, is that a thing? I need to do it. So that's so sad about I wonder what's going on the why this output's not working. You can make anything an emote. I need to, yeah, I haven't really messed with it in a long time, so I definitely need to work on that. So let's see. Outputs. Main encoder.
Are you missing the clinic I just put on?
Dude, that doesn't even excite me, brother. No, just kidding. No, I'm sorry. I heard the.
I'm over here doing God's work.
Fully cracked and just like snapping around, dude, going hard.
I'm over here like my Twitch isn't working.
I know. I'm bad. So okay, I'm gonna try to do a little switcheroo here and see if we can get this thing going though.
I need you to find me.
I'll find it. Okay.
Shit.
I'm trying again on check on that's very weird. So then now if I go back to the live, oh no, it does show a black screen, doesn't it? Shows the whole video, or it shows the, it's weird. I don't know if it's working or not. Give me a heads up though. Let me know, guys. So I apply tretinoin nightly. Do I still need under eye cream? I mean, if you're able to get it on like somewhere close to your eyes, then you don't necessarily, I wouldn't say, wouldn't worry about it as much. Oh wow, that was great, brother. Is it gonna hit? No. What do you think, guys, about the, if you turn your phone to the sideways, do you get a full horizontal output, guys? What other questions do you guys have about sorry, Chris.
Bro, I'm over here trying my life.
Sorry, I'm over here looking at this. I'm messing bad. Derm ordered blood work and your daughters are 17. I honestly don't like, I mean, it just depends what's going on. I don't know if they're on Accutane, you know. I don't know if they were worried about some rheumatologic condition, but for routine like dermatology checks, we don't really do, wouldn't really do that a lot. I don't know, but I'm sure they did for a reason. Removing skin tags at home, generally don't really recommend it. If you go to the dermatologist's office, usually what we'll do is we'll numb them up and snip them away or freeze them away, those kind of things. First time visit for acne, they might be looking at doing Accutane, maybe. There's really not a lot you'd check on labs for like routine mild acne though. Is Cetaphil good? What do you think, Chris?
I love Cetaphil.
Mm-hmm.
They have really cool actual neck cream coming out, or it might be out yet.
Mm-hmm. The neck cream coming. Yeah, Cetaphil's good. Cetaphil, CeraVe, La Roche-Posay, you know. Thoughts on Panoxyl? It's one of the best, like, anti, you know, like, it's like an acne cleanser. Very good in that way. So, will there ever be a vitiligo cure? I use Opsilera, but results are taking forever. No doubt about it. It does take quite a long time to, like, to get the results there. So, yeah, Anna's got the eyes. She's like, they got a new neck cream coming out. She's got the googly eyes. Yeah, I think there will be a cure for vitiligo. I think there'll be a cure for a lot of stuff, especially with, like, you know, as we move towards this AI stuff and developing drugs with that. And Zach wants to go 1v1. Brother, I can't do that. I don't want to roast you that hard. You couldn't handle it, Zach.
Zach, you can't even go ban for ban, all right?
No, dude. he's got the skull emoji up. He's like that. No, brother, you probably racked me, bro. I mean, you saw how I just played. I'll say it though, I was distracted a little bit.
Yeah, sure. Yeah,
I was super distracted.
Clinics, bro, over there. I was killing people.
I just heard all the just like the big bam, you know, like the finishes. I heard them all. I'm like, what's happening, dude? What's going on here? Let's see. So, how can I get rid of tinea? We got any tricks for that, Chris?
Depends. Honestly, if it's really a lot of it, I would go on oral medication.
Yeah.
If it's just local, just creams, just make sure to clean out your shoes too. That's the biggest thing, so you don't reinfect yourself.
Right. You go through all this hard work and then you end up getting reinfected, which kind of stinks. So a lot of times we'll use terbinafine. We use a lot of terbinafine. We use topical ketoconazole, you know, things like that. So different ways of doing it. Acne scars pitted and deep. If they're pitted, like ice pick scarring, you know, I know my buddy Chris over here does a lot of phenol treatments of those. You can do TCA cross. Lasers and microneedling don't necessarily work as well for that, but deeper ones, the mix of subcision, which is like using like a needle or a cannula underneath the skin to break down some of that scarred tethering. BP plus TRET, what's the verdict? I mean, the verdict that I say, both, I agree. You can have them in the same routine, but I wouldn't do it at the same time, basically. That's what I say. Looking for a good moisturizer that leaves no residue behind. I mean, Remedy has a great one that's very good. One of my go-tos is always just the CeraVe moisturizing lotion. I think it's very good.
Kiehl's Ultra Facial Cream.
Okay, Kiehl's Ultra Facial Cream. You heard it here first.
L'Oreal Paris Midnight Cream is really good. Thicker.
Is it pricey? Is that pricey?
No, it's like $26.
Oh, not bad at all. Very good.
And it's honestly, it is like luxurious. You put that stuff on, you're like, damn.
It's rich. You're gonna wake up knowing you're hydrated up. Does the L'Oreal one have fragrance?
It does.
It is fragrance.
It is fragrance, but it smells delightful.
Yeah, there you go. Why
I don't mind for it. I'm one of the derms that don't really care about it. Like if you can tolerate it, I like fragrance, but
yeah, it's true. It adds something to
everybody.
it. You know, it adds something to it if you
like people they like to want to use it. You know.
Yeah, exactly. It's gonna make them feel good. There's an enemy like on my marker downstairs. Not on my mark. Not on my tree marker. He's under us directly. He's on our side. Probably behind you, basically.
Hit some shields on him. It's hilarious.
Nice. Oh, sorry.
You were
sorry
blocking me. Damn.
I'm trying to mess up your good progress here. So my computer is actually feeling the streaming pretty bad. I think it's pushing its limits right now. Brown spots on the face, you're 36 and they're getting bigger. Should you be worried? So, you know, most likely, you know, they could be sunspots and we can get some more as time goes on. But if you're worried about changing dark spots, it's always a good idea to see a dermatologist in person. Just make sure it's nothing worrisome. So, I hear them.
They're both under there.
Tips for oily skin. I think a good cleanser for oily skin in general would be the CeraVe Acne Control Cleanser. It's got a little bit of clay in it too to absorb oil, and then it has some salicylic acid at 2%, which makes it a really nice like concentration.
What are your thoughts about me putting a smoke down here and just
rushing it? Let's do it. I got my shotgun out. Let's go. Which way are they?
Oh, they're pushing.
I'm pushing.
Watch out. Sorry.
Coming back.
I don't have shields. I realize I don't have shields.
I have shields for you here. You try out BF6 beta. So late night design. What's up? Yeah, I played. Is that Randy? Are you on here, brother? I played BF6 both weekends all the way through. Hit all my goals and stuff. Love it. Big fan of it. Yeah. What's up, Randy?
Oh shit! Guy right in front.
Yep. If you want to hop on, Randy, feel free too, man. You're welcome to hop on. Oh, you had a loadout, bro. So good to see you. Yeah, I was a big fan of BF6. I liked it a lot. Chris was a bit skeptical.
Yep, I hate it.
You got gas mask for you? It's a fancy gun.
It's got like right above us.
I wish I could nuke my HS flares. No, I think you're not alone when it comes to that. Such a frustrating condition in general. You know, it's such a hard one. What to do about the schmegma? It's a good question. You gotta just, you gotta cleanse, brother. And retract and
Cleanse, brother.
cleanse. Retract and cleanse. You know, but it's a real thing. You know, you may end up with some. You know,
if you leave it, it's bad.
It's real bad.
You leave it, it's bad.
They cook the tip right off.
It's carcinogenic.
Yeah. You get a SCC on the glands, and then you're in for it, in a bad way. What made me do derm instead of another specialty? So I said in my personal yeah. I said literally in my personal statement to going to medical school that I want to be a dermatologist. So I always knew I wanted to be a dermatologist. And when I went to dermatology residency, in my personal statement, I said if I can't get into derm, I'm going to work at Burger King. And I didn't actually say that, but I told it to my friends. You can't have a plan B. If you want to go into dermatology, you can't really have a plan B, because if you do, you probably won't get into derm. That's my opinion. I remember my ex getting mad at me. She was saying, "What are you gonna do if you don't match? Have you even thought about that? Have you even thought about that?"
Such a negative attitude. Bye.
Exactly. That's basically exactly what happened. And I was like, no, I haven't thought about it because I plan on matching, you know? She's like,
whoa.
What are they close?
No, I was going to hit from somewhere.
That was a real Debbie Downer, Alicia. A lot of other stuff weird happened with that too. I remember one time, one of the great achievements that a medical student can get is getting into AOA. It's Alpha Omega Alpha. It's a prestigious honor society, right? That, you know, maybe like 10% of the medical school class gets. And I remember she got mad when
damn.
Where's the zip at? Mark the zip.
On the inside.
Inside, okay. Coming in.
No, fuck, they're landing on me.
Are they? Should I just run then?
Yeah.
I have a lot of money. I'll just buy you back. Or you have oh, they're actually chasing me. They actually want to kill me too.
Damn.
Does sunscreen give cancer? Absolutely not. Sunscreen actually quite directly prevents cancer. So it's a huge misconception, and there's a lot of people that unfortunately spread bad information online. What's the sign that your cream is working for the fungi? Less scaly, less red, less itchy, smoother. Just
Damn, you did too?
Yeah, they actually chased me down. They didn't even... Do I wear sunscreen while gaming? I wear sunscreen every single day, so I have it on my face because when I got ready this morning, I put it on. And as you guys know, I'm like recovering from the laser on my forehead. So like I went to breakfast and stuff, and my 16-year-old has severe urticaria on Xolair and propranolol. He's being admitted next week. Oh my god.
That sucks.
Yeah, that's horrible.
Sorry.
It's like bad for, you know, for it to be that rough, that aggressive, you know what I mean? And oh wow, this guy came out of nowhere, dude. He came up fast on me. Thoughts on peroxide? Peroxide itself is like not great for wound healing. Nice job, man. He showed us how it's supposed to be done. Tazarac for people with acne scarring? Absolutely. I think it's a great combination, like, or doing Tazarac if you can handle it. Now, a lot of people have a hard time tolerating Tazarac, but it can be helpful. Hard skin on one part of your toe, like a corn or a callus or a wart. Those are the common things since December of 2024. So the good news is if it's a wart, I mean, by December of 2026, there's a pretty good chance that it'd be gone, but on its own, but from basketball. So yeah, I don't know, because you're probably walking around the gym, you're in the shower. Could be that, or just could be like friction and in a corner, a callus or something like that too. Finish my story. Which story was I talking about that I didn't finish? Sorry. Thank you.
Have you guys ever realized on the stream, I basically carry Dylan?
Yeah, I mean, that's totally fair to say. I think I bought him back exactly 0 times. And he's bought me back about 6 in the 2 games we've been in. So yeah, I have a small round spots of flaky skin. So there's a lot of things that can be circular, small, and flaky. But white, you could have two things, you know, with very mild flaking. This is something we commonly see, like tinea versicolor, which is kind of like a hypopigmented white with powdery scale, or maybe something like pityriasis alba, and that's like a very, very mild form of eczema, basically. Is chronic colitis a thing? It is. You can see angular colitis. You can see actinic.
Yep.
Yeah.
So a lot of sun damage. It's chronic.
Yep. Exactly. I do have weekends off. I think Chris usually takes weekends off too, Dr. Tomasian.
Yes, sir.
He's here with me. For those of you guys in the chat, thanks for the taps, by the way. Appreciate you guys coming through today and hanging out for a little bit. So, again, I'm Dr. Dylan Greeney. I'm a board certified dermatologist here to help you get your best skin. And I got Dr. Chris Tomasian with me.
A regular dermatologist.
He's just a he's a dermatologist. Yeah, exactly.
No, I'm just kidding.
Yeah, no, he's not gonna give the full spiel. The board certified.
I'm just here for a good time.
To be honest, he's carrying the team.
Dylan's got the best tips, so just follow him.
I got good tips. No, you follow Chris. He's got it all. He's got the entertainment factor. He's got the carrying factor. He's got the dancing factor. He's got it. He really truly has it all. Oh, so yeah. Sweet. So the story. So the story was just like, basically the story was just, I got AOA.
Here.
I posted about it, which is an enormous accomplishment.
Stay here, okay?
Okay. And she got really mad that I posted about it. She got mad that I shared it. I remember that. That's hurtful, right? It's hurtful stuff. But it's okay.
Actually, you want to get on this with me? I didn't know how far it was.
Oh, are you going to?
Pretty fucking far.
Are you going?
Yeah, we're gonna go to I want to get some cells.
Okay. Are we going together?
Yeah, get on.
Okay, hold on. Will a trend give you acne? Most likely, yes. And also testosterone replacement therapy, anything like that, usually will. Is IPL effective? It's very effective, especially if the spots are fairly dark and your skin's fairly light. It's actually a great way to like rehab like a very broad area. Look at this. We're red. I'm terrified. They're here for sure, dude. We're about to feel it. So, yeah. What else was I gonna say? Remedies for women with hair loss: oral minoxidil, topical minoxidil, PRP injections. But you want to make sure you're, you want to make sure that you're like doing all the like low-hanging fruit first. So make sure you're doing like the minoxidil and stuff like that, because that's very proven, and not everybody benefits from PRP and stuff, and it can be very expensive. Why is my skin getting dry after a shower? So hot water tends to dry out the skin, and it's a great time to soak and seal. So that's a good time to use a moisturizer on your skin and lock in some of the hydration from your shower. Dermatologist is an expert in the hair, skin, and nails, and it takes a minimum of 12 years of training to get there. It takes, 4 of undergrad.
They might be pushing you, actually.
Okay, I'm coming to you. 4 of undergrad, 4 of medical school, and 4 of residency. I'm gonna get a project car. What should I pick up?
What's trying me?
All right, trying to get in real quick. What kind of project car should he get?
You're red now.
What do you think, Chris? Chris is locked in.
They're pushing.
And they're down here. Is that yours?
I stuck on my thing.
Why do I have redness around my nose, but it feels dry? That's seborrheic dermatitis. It's kind of like dandruff for your face.
He's coming up to the side.
Yep. Through the stairs?
Yep. Right here, I think.
Okay. Oh, okay. Where are they? Where are they?
I think this door. I'm low.
Watch it. I got armor down for you if you need it.
Pushing back, pushing back.
Yep, come with you. Do rubbers effectively protect against STDs?
Got him.
Any throwables?
Fuck. Did you get the other guy down?
No. He's up. He's up. They do against some and not as well against others. Things like HPV and herpes, probably not. It probably is a lot more effective for things like HIV and.
You didn't get the other guy down all the way, right?
I did not. No.
Fuck.
Thank you guys for being here again. Veins under the eyes. Yeah, actually one of the best treatments you can get for veins under the eyes is called Derma V. And it's a laser they can use. 1064 wavelengths. And it's one of the highest, best like vascular lasers on the market for redness vessels. And sometimes you can get it. There's people across from us, by the way, like other building, like right over here. I joined as a 91 whiskey, which is a combat medic, and then I became a 68 whiskey, which it was, you know, also a combat medic, and then I had additional skill identifiers in Mike 6, so I was a nurse in the army. Don't have many plays. Dermatologist and a gamer. That's right, Maddie. And is hair loss reversible? Some of it is, some of it isn't. Keloids don't.
Oh wow.
Nice.
There. You got shields, right?
All right.
Sugars. It's very scary.
Lysine and azelaic acid for rosacea. I hear about lysine a lot. Aza Posey recommendations for acne scars. Do a lot of like laser for those, fractionated laser, full field, fully ablative laser resurfacing, subcision. Just a good skincare routine with vitamin C and retinol and stuff at home. But you can do some home microneedling, you know, Cure, Banish. These are good brands to do that with. Dark spots, really like laser for dark spots, but about the best over the counter for dark spots would be Remedy for dark spots. Gold standard treatment prescription wise would be things like hydroquinone. What kind of demonic spirits have I exorcised? Probably the two I've exercised the most. I would say it was like scabies and or delusions of parasitosis, which are actually delusions of parasitic infection with antipsychotics. Redness, there's not a lot of perfect things that you can get over the counter. But maybe like a niacinamide serum, like Kiehl's niacinamide serum is very good.
There's someone there.
Okay.
I'm gonna grab that bounty actually.
All right. If you seriously want to improve scars, it totally depends on what's going on with the scars. If the scars are red, vascular laser can help. If they're thick and what we call hypertrophic or keloidal, injections with steroids or steroids and Effudex are going to be your best bet. Silicone tape is a good option when you're first like have a new wound. It's a good way to kind of keep a scar looking better. Acne comes back for some people after Accutane, but not everybody. Like a lot of people do just fine.
He's at the buy. He's at the buy. There's a guy next to me too. Oh.
Is Brad's asking, is BCC in the death zone a problem? So I think he's talking about the triangle of death. But
you still remove it. Still remove it.
Yeah, you want to get it treated. It is a high risk area technically, but with basal cell, you know, the big thing is you just don't want to neglect them. They very rarely, almost never metastasize. But it is in the central face, so it's a hard area to, you know. Miles, thank you so much. Said I love you.
We're gonna have to move up, man.
Yeah,
We're gonna have to
you
move
knew that guy
up.
was here, right? On green.
Yeah.
You knew about that guy. I popped him a couple times. Oh, I hear him. Friendly grenade.
That was your?
Yep.
Scare the shit out of me.
Sorry, bro. Sorry. Best tooth whitening. I've always been a fan of Crest White Strips. I will say, don't go generic. I went Equate, and it felt like I was putting like a rubber mat on my teeth. It was so thick, it would barely even fit to my teeth. So Crest White Strips is the way. Yeah.
Whoa, whoa, whoa,
I got
whoa,
zapped.
whoa,
I got zapped a little bit. Lily Ray Nelly. The stress wrinkles you're talking about between the eyes.
Gotta move. We gotta move.
Okay. We call those the 11s, and they're from scowling.
Whoa.
Are you able to get up from there or anything?
Got
it. And the best treatment for that, and honestly, you're wasting your money if you try to shoot with anything else.
Shh.
It would be, Chris, this is important. It would be Botox or Dysport. There's a mine by me, bro. Don't come in here. There's a mine on my marker. I'm gonna pop it, okay? They're looking for...
This gases are really just not doing it for me.
No, it's okay though. It's okay.
We should go left.
I know you'll buy me
Way
back
left.
if I die. So prebiotic, probiotic creams. I mean, they're looking at different ways, you know, that the gut and the skin microbiome plays a role in skin diseases.
There's a guy in here.
Ready? Concussions in, no hit. Oh man, we landed right on this mortar. Should we clear this upstairs? Gas is creeping again. Have gas mask. I don't think you do you? You need my gas mask so you can get this dub?
Where are we going?
Here, get this gas mask.
No.
You're gonna need it. You're gonna need it.
Just take it.
So we're 9 alive. Lock in, chat.
I think there's a team here too, so just...
Okay. Comms are going quiet.
Guy struck there.
Nice.
Got one.
Nice. Lock in, chat. About to dub up here.
Watch the left.
I'm watching it. I have no long range, by the way. Put it reversed here.
He's in that window.
All right. I just blasted him hard. I whited him out. Whited him out. That's so dumb. You got sniper glint from the other side too. I'm sorry, bro. I'm sorry. That's hard. Dang, dude. I'm sorry, bro. Yeah, I got on your window, guy, but I kind of feel like there was like some desync or something there because I feel like I got behind the pillar and he still took me. I think if you look at the damage though, you can't say I didn't do nothing. You know what I mean? Yeah, did some damage.
BRB.
All right. So, all right, ketoconazole, but always comes back. If you're talking about fungus, it can come back. If you're talking about seborrheic dermatitis, it definitely can. Skin tags at home, I wouldn't really recommend. There are a few over-the-counter things. Let's see the graphic settings. Let's see if I can pull it up here. It's pretty high right now, I would say. So, for those who care, this is what we're working with on the graphic settings right now. 4K. Full screen. This should be, honestly. Oh, full screen portal. That is fine. Quality. Ultra. 4K Ultra. I could definitely turn this down a little bit because I'm not getting a ton of frames here. So let's see here. So let's see. It's not a good idea really to drink alcohol while you're on Accutane at all. You know, one of the most common things we see is maybe elevated liver enzymes, and it can be tough in that way. Normal to have hormonal cystic acne at 24. So definitely, you can see it now. Guys, acne does tend to calm down a little bit. Holy Grail face product. I mean, if I could just pick one thing, honestly, it'd probably be like Brandify Vitamin C Serum. 90% of the pros in Warzone have their settings on low. I don't doubt that a bit. I mean, it is so like it's like crazy right now. Yeah, you don't want to have this too high and drop your frames. Not to mention I have like 4 stream outputs right now, and I'm streaming just single PC. IPL for red skin, it can be helpful. You can use IPL to treat redness and browns, but a dedicated vascular laser kind of is very nice, but sometimes you could make it work for that. Does the blue Head and Shoulders dandruff shampoo actually help with dandruff? So Maddie, it definitely can, but there is like, CeraVe has an anti-dandruff shampoo now. Remedy for dandruff is another really good treatment too. Thoughts on Eraslo for acne scars? It's a great option. But what can I put on my face for psoriasis? A lot of times we'll use topical steroids for that, or steroid sparing agents that are prescription. At home, you're kind of limited to moisturizer, maybe like some 1% hydrocortisone. And oh no, yeah, you want to get that dandruff cleared up. No, for sure. Definitely don't remove a mole for yourself at home. Guys, tap that screen, guys. 3,300 taps. Tap that screen up. Run those taps all the way to the top. Let's get up to 5K, guys. We're all hanging out. You guys are asking these questions. Maybe run those up there. Double tap. That's right. Thank you, Miles. I appreciate the hype. Farm gals from Cape Cod. Awesome. My wife was just like talking about Cape Cod, and I got it confused with Cape Canaveral. All right, we gonna lock in, Chris. You gonna lock in this game? This is like, yeah, because I'm only get like 60 frames. It's like kind of rough. Let me see if I can switch it. I don't know if I switch it right now, if it's gonna like. Is that gonna help my frames? Basic. I'm gonna get dizzy. Small dry patches on the scalp. I would use a good anti-dandruff shampoo, you know. Fixing back acne, you're usually gonna need prescription treatments, but you know, at home, your best bet would maybe be using like CLN body wash or benzoyl peroxide 10% body wash. No perfect way to get rid of vitiligo, but topical steroids, Narrowband UVB, perioral dermatitis, about the best you can get over the counter would be like azelaic acid from companies like The Ordinary. Henry, it's so good to see you. It's been way too long. How fast can I run a mile? Probably like, I don't know, man, like 7 minutes. I mean, I'm just not great at it right now. Collagen pills make a noticeable difference. Not necessarily, I wouldn't say. Keep tapping that screen, guys. Almost 5K taps. Where are we going, Chris? Just floating. I did not consider other specialties, only dermatology. Post-acne hyperpigmentation, Kenesha, the best product that's out there is called Remedy for Dark Spots. Remedy for Dark Spots. Armpit acne, CLN body wash would be my #1 recommendation. You go backwards. Skin and boil and groin areas. So a lot of times what that really is hidradenitis suppurativa. So it's actually a different condition. It's not just acne. Yeah, taking collagen. I don't
Sorry,
feel. No, you're all right.
Back.
I was just floating under you. Where do you want to
go? Let's go right here.
Okay. Turn my graphic settings down. It looks so bad now. Looks so bad.
Oh, whoa.
Getting beamed already?
Yep. Do not come here.
I'm gonna. Yeah.
Do not come. I'm coming.
Coming. I'm gonna come. So, let's see here. Oh
God. Oh, yeah.
I should have listened.
You don't listen. Sometimes I think you just hear it.
I'm trying to.
You feel like you're a big boy.
A little ornery. Thoughts on tanning lotion? I mean, using fake tanner is fine. It just kind of just stains the skin cells in that. No problem there. But it doesn't provide you benefit. Oddly enough, when you look at people and you survey them, they actually think that applying fake tanner does protect their skin. A lot of people do think that. What can I add to my tret to help it along? You actually don't need to really add much to tretinoin. It's just make sure you're in a good moisturizing routine. So that way you can hopefully optimally use your tretinoin every single night. That's going to be your best way to kind of get your to get your best skin. So I would do that. Azelaic acid is really one of the best treatments that there is for. Please. No.
Once again, Daddy has to work double.
Back at it. Overtime, dude. I need this. Best solution for closed comedones, the two things that are really going to help with that is going to be salicylic acid, like cleansers or toners, and then adapalene at bedtime. Those are your over-the-counter options. But a lot of times we're gonna prescribe tretinoin or something along those lines. Collagen helps with wound healing, not particularly helpful for anti-aging necessarily. For eye bags, using a good retinol eye cream, you could do laser under the eyes. Obviously, sometimes it's to the point that you need surgery, so like a lower blepharoplasty. Thoughts on tummy aches? I think they're a little too common. I think it sucks when it happens. You know,
We're talking about a tummy ache.
a tummy ache, dude. What do you got? Any advice on tummy aches?
I'm not a skin doctor. It's malpractice for me to talk about
tummy aches.
such complicated topics.
That's right. Abdominal pain is no joke, you know. I mean, it truly is a complicated situation. Lifestyle changes to help with seborrheic dermatitis. Shampooing every day is one that I think a little underrated. A lot of people feel like their scalp is quote unquote dry, so they shampoo less.
You want to give me the bunker code for this?
Oh, I got so much going on, bro.
Oh yeah, you have like 18 things open. There's no way you could do it.
I can't do it, bro.
Yeah, you do that, they're gonna be like,
pull it up.
Jeez.
No, pull it up. Pull it up. Pull it up on your phone.
All right, let me what is this? Where are we at right now?
I would call this like probably like boneyard-ish. Did I play Warzone 1? I played everything. So we're playing with Dr. Chris Tomasian. He's an honorable guest to the stream today. Chris Tomasian, one of the most followed dermatologists in the world. Brilliant. He's a private practice owner, cosmetic expert, dermatologist, amongst other things. So we're lucky to have him here. If you guys have particular questions for him too, you can ask, of course. Do you need a punch biopsy for psoriasis diagnosis? Generally, no. It's pretty rare in the case of like your typical psoriasis that we would have to do a biopsy to prove that. Azelaic acid is like it's a very good treatment for hyperpigmentation. It's a good treatment for rosacea. So.
Bro, none of this shit work. Where are we? Oh god, we gotta move. We gotta move.
Okay. We got a car.
You need shields? I don't have any. Actually, I do here.
Oh. Thanks. Best way to treat folliculitis, I would say CLN body wash is one of my favorite go-tos for it. A lot of times you use doxycycline for it too. It's horrible, you know, kind of like in the acne category, isotretinoin, Accutane. Treatment for large pores, resurfacing lasers, like Halo, things like that.
Let's zip up here.
Thoughts on finasteride side effects? Usually happen.
Very rare. If you don't think about it, they don't happen.
There you go.
Honestly, I think they did a study. It's like 30% of people, if they know about the side effects, it
happens up more.
Yeah.
So I think that's a good pull. What was that?
The team right here.
Yep. And there's also one in the fire station. Yeah, and they do tend to happen to like younger individuals. Also, history of anxiety and depression, a little bit more likely to happen in those crowds. Hit him a little bit. Non-operational options for large pores. What is that from Storage Town? Oh no, I'm getting hit from fire station.
Let's get us money.
Crepey Skin Fix. I like retinol body lotions. Gold Bond makes a retinol body lotion. Also, Versed makes a retinol body lotion. These are some of the lasers. I guess Chris is out in California. Dr. Tomasian's out in California. And people will spend money on their neck, their chests, sometimes their hands, but it's rare for me to treat
arms and stuff is hard.
Yeah. I didn't know if it was any more popular out there where you're at.
It's popular. The problem is you have to do multiple treatments. It's pricey because it's a lot bigger surface area, obviously.
Treatments are less aggressive, but slower to heal. I know if I BBL somebody's leg, sometimes they still have like freckling for like 3 weeks after.
We don't BBL legs anymore. Okay,
no, that's true. There you go. That's true. We off that.
Right to jail. You right to jail with that. No more.
None of you from Massachusetts. Yeah, no, I'm sure you could. Massachusetts, maybe Boca Raton, they're lasering every bit of it. If it's got epidermis, it gets hit. Purpura. I gotta assume you're talking about senile purpura or solar purpura, because if you have actual like purpura from like vasculitis, vasculopathy, I mean that's a big deal issue. But the typical little bruising on the arms and stuff like that, arnica supplements. Tell
them about that cream you told me about.
Oh, the cream. Yeah, I forgot the name of it already. What was it called?
Silfirm.
Okay. Yeah.
So it is? I don't know. I just might have made that up.
I don't 100% know. But there are some dermatologist designed creams that have combinations of vitamin K, arnica, stuff like that in it that can help to reduce bruising. So those are things that can be done for that. Struggling with tinea versicolor. Ketoconazole body as a body wash shampoo, or you could do like Selsun Blue shampoo as a body wash. These are ways to reduce.
Bro, you gotta move. You gotta move.
You're I'm moving.
Right behind you. Right behind you.
No, I'm fine. Best drugstore retinol, I would say, would be ROC. ROC. The nice
spot of that. Fine.
Okay. It's very nice because it's non-irritating, which is one really nice aspect about it. Is it's non-irritating, but it is effective. You guys use retinol or tretinoin? I use tretinoin or other prescription retinoids, and probably 95% of my patients use prescription too. Thanks for you guys being here, by the way. Thanks for the 5,800 taps, by the way. Tap the screen, guys. Run those taps.
Let's get that up to 10,000. Yeah.
Pump it up to 10K. Pump it up to 10K. Dr. T's like first stream with me, or like, oh, I was in the open, bro. I was running. They're over here.
Whoa.
They're right there. I marked them.
Sorry, I gotta get out of here.
You gotta go. You just gotta go. Yeah, it's okay. Different gel, very good. So, we're hoping to pump up those numbers, guys. It's Dr. Tomasian's first live stream on here, gaming live. We frequently play games. They're double chasing you. See that? See that?
Yep.
It's a problem.
Luckily, I've been watching Fast and the Furious longer than they have.
That's right. Exactly. You know how to. Best for cystic acne is Accutane. There's actually nothing else that's really going to treat true cystic acne, and actually put it behind you. Sebderm, thanks, bro. Sebderm is like an inflammatory condition of the skin. Oh wow, they're converging on you, bro.
Big time conversions.
They went. They went on. Oh, and they're getting hit with another team. So they're still there, though.
There's someone in Firehouse, so just be careful.
Okay. Best technique to combat dandruff. I've been rotating the Remedy for dandruff and CeraVe anti-dandruff shampoo. That's been my strategy lately. You kind of get multiple ingredients in that way. You get salicylic acid, ketoconazole, and parathion zinc, which is, a nice combination of things. I'm not actually very familiar with like any organic shampoos.
Oh! Did not see him there. I literally walked right to his face. Did not know it was a guy.
Really? Nobody's gonna come out to loot you, bro. I missed him too. marked, so. You said fire station was hot, didn't you? It's hitting. I'm gonna need you to pull yourself up by your bootstraps, bro. Cause I can't do it for you, bro. SkinCeuticals, oh no. SkinCeuticals is pretty expensive, I would say. It's kind of, you see that guy there? It's very expensive.
I might need you to pull yourself up by your bootstraps.
No, you. Is this underground or is this up top? It's up top.
You gotta put those shields in, bro.
I don't have
You're
any
gonna
shields.
get
I don't have no
wrecked
shields, bro.
about.
I don't have any shields, bro.
Oh, dude, that thing's out of bounds.
Is it?
You're screwed. Yeah.
What? At least it took it away. I was gonna say that's some BS. So there's those two guys. I should have tried to run them over. Cause what's the best for back knee? Can you answer chat, Chris, while I focus up and lock
For
in?
back pain?
No back. No, dude. We already off the tummy aches. I got thermite, bro. I got thermite.
Yeah, you get out of there. You're dead. It's
no,
fine.
no, it's gonna survive.
Oh,
Oh.
Yeah.
Okay. Dermatologist is the skin. One thermite does it. It takes the whole truck out.
Yeah, because it keeps going through it. It's like thermiting through the engine block.
Thank you, Lil V. It melts the engine block.
Mm-hmm.
Man, your imagination's going wild, Chris. I took a 50 cal and I shot it through the engine cooler, dude. It overheated.
Yeah, dude. That's why you're smoking out there.
Yeah.
You don't notice that?
I thought I was good.
All right, what was the back knee? Back knee
back
question?
knee. How do you treat it? How do you treat it, Chris?
All right, hypochlorous acid spray, okay? That's one.
Okay.
2, benzoyl peroxide, 10% wash. Leave it on for 2 minutes, 3 times a week. 3, go see your dermatologist because you probably should be on some sort of retinol. If you can't see a dermatologist, use adapalene. 4, make sure to always be washing right after working out so you don't trap your pores and get some bacteria in there. 5, you might need some oral antibiotics. That can be the case. Oh my God, it's oral antibiotics. I'm super scared about it. Don't be. This is a safe word.
Don't be.
Still not great. Uh-oh, what do we have next? Accutane. Boom.
That's right. Somebody gotta do that Accutane.
Controlled.
Yeah. That's it. As simple as steps to better skin. He's looking them up. They accused us. The chat accused us of looking up how to treat acne, bro. We're cooked. We're cooked, brother. Oh man.
They accused us of looking it up?
Yeah, they said we were looking it up. That's why.
Bro, I was over here trying to survive in Warzone, okay?
Yeah.
My brain isn't good enough to do 4 things at once.
That's right. We got to look up the hard ones. They say we're on ChatGPT right now.
Yeah, I use ChatGPT 5 though, yeah.
GPT 5, it's quick. We would have had popped it off faster.
I'm not gonna lie, I think 4 is better than 5. 5 is a little. I think the 5 ChatGPT 5 has been a little bit like it's thinking too much, and then like it generalizes things, and sometimes it just lies to me. Like, well,
I've heard about that.
Why are we lying?
I've heard about
lying
that
right now.
Yeah, I mean that's not right. I shouldn't do that.
I mean, I'm a small man with just some
Jade. Yeah, Jade. We are talking skincare and playing games. So we're kind of in between games right now, but we're still talking skincare. So.
Yeah. All right, here's for the chat. What do you guys want to see Dylan post more of? His polished, good videos, or like more raw, to the point, just skincare facts, just giving you all the knowledge. Polished or raw? Give it to him straight.
Yeah.
What does
let's
it
see.
say? What's the chat saying? What's the chat say?
Raw to
W's
the
in the
point.
chat. W's.
New favorite
W's in the
streamer.
chat.
Thank you. Lil V says raw.
Raw
Or
baby.
polished? Jade said raw. Next question. So Farm Gal says raw.
See, dude, you just gotta be raw about it.
Wow, dude.
Right now,
Okay. You know what? Just straight to the point, raw. Okay. We know. How often should you be using tretinoin? Weekly. Ideally, you need to use it every night. Brandon says always raw. So yeah. Let's see.
Your fancy camera, sell that shit.
Get rid of it. But I know.
Get that iPhone out.
Sell both
Get
of
a
them.
little dirt on that iPhone.
That's
and
right.
get raw with it.
That's right. That's the move. Also, thanks for the comments on the other platforms here too. Appreciate it.
What do you think about this glow recipe mucin serum?
So I haven't personally used it. I saw someone post something about, oh, what do you think the sample's from? And it looked very glow recipe. Is it like something that's still in a beginner stage? Or
because
is
they
it...
told people to post about it, so it was like, I don't know. It's kind of interesting, but it's mucin. It's just like 100% mucin.
Yeah. From the squirrels?
It's given CosRX.
Yeah. And probably maybe slightly more expensive price point, but what shampoo should I use? I really like the CeraVe shampoos that are out now. I think they're very good.
L'Oreal Paris Elvive Hyaluron Plump.
There you go. Still looking
That
for
was delightful.
Hyaluron Plump. Does it give you the volume? Does it give you the shine?
Gives you kind of the shine. It's very hydrating.
Mm-hmm.
So kind of holds on that hyaluronic acid into the hair.
Mm-hmm.
Traps that water back down on you.
Yep. Accutane, is it worth it? It's definitely worth it. It's definitely worth it.
If you're tough enough.
That's right.
You know that meme?
Yeah, I do. I definitely. Yeah, I totally. Yeah. Yeah, there's some people chatting here. I'm so sorry.
Accutane is game changer, guys. Just go on it. It's like, don't be scared of it.
Mm-hmm. You can just get through it. Okay. My MCAT score was actually not great, and nowadays the MCAT's so different that someone said they're buying their skincare at Dollar Tree. I mean, you gotta do what you gotta do. Yeah. And you'd be surprised at how a lot of skincare is made in the same place. Now, I don't know if Dollar Tree is made in the same place. That might be different. Eczema on the scalp and behind the ears. What do I do? So I will say a lot of times it's kind of rare to see like eczema on the scalp a lot, but you could sometimes have an allergy, like a contact dermatitis to something in shampoo, where you'll get a lot of issues on the scalp and ears. But more commonly, I see psoriasis on the scalp and behind the ears. Can you use Accutane and Tret together? You shouldn't really. There's no real reason to.
I got guys on me.
Okay. Are you down low? Are you underneath? So many people.
Down one. Please God, tell me you don't have a pistol right now.
I do. I finished your guy though. I do have a pistol. Because I landed on the top. I landed on the top.
Jesus Christ. But I can tell you, you probably were the most useless guy to come with a fucking pistol.
I know.
We were dropped for a good 2 minutes.
I dropped like 2 minutes after you, and then I flew to the roof and I looked down at everybody inside, and
admiring the view.
I was admiring the view in a lot of ways. Let's see here. Hey, Savage. It's going real good. Thanks for checking on me. How you doing, brother? Eye cream for 80-year-old. Again, I like Versed Smooth Landing Retinoid Eye Balm or Brandify.
Peter Thomas Roth.
Peter Thomas Roth. You talking about the Firmax?
Yeah, for an 80-year-old.
Oh yeah, Firmax. I mean, it's a little bit of a trick, right? Like
I heard the new one's not as
like as much of a learning curve to it.
As it's not as sticky.
Oh,
either.
okay.
Like it doesn't give that residue.
Yeah. Yeah, they could afford to tone it down a little bit.
Where are you? Top, bottom,
I'm
middle?
like that mid level, yeah. Oh god, I got scared there. I saw a little spark, dude. I thought I was dead. Does working out accelerate male pattern baldness? No. I do have Morphia patients, yeah. Products for KP, I just use like CeraVe SA lotion and amlactin lotion. LC10 here if you want it, gold.
Should we get out of here and go get ourselves a Lodi?
Yeah. Best for psoriasis is I'm gonna fly over to across the street. What do you think?
Let me go over this. Oh, it's the one across, like in that little
I was
housing
thinking about
area.
it, but I mean it could be hot over there too.
No, you could go.
Okay, I'm gonna go.
It looks good right now. I don't see anyone.
That was a weak jump. Does Dupixent cause morphia? No.
No.
Woo!
All right, where to? Where to? Bless you, bless
Thank
you,
you, thank
bless
you.
you.
Blood bumps under the face. Those would probably be cherry angiomas. And you can very easily treat those with a laser. Just one. Thank you, guys. Thank you, thank you. What do you use for your skin? I use Gentle Cleanser. Right now, La Roche-Posay Tolerian Foaming Facial Cleanser. I've been using Drunk Elephant Vitamin C, but a great affordable alternative would be Brandify Vitamin C. I've been using the Drunk Elephant Amino Rain Glasswater Serum too. That gives me a little bit of glowiness. And then from a sunscreen standpoint, I've been going through a few different ones. I've been using the Kills one that Dr. Tomasian here got me on. What's it called?
The UV serum.
Yeah, Kills UV serum. I sometimes use Supergoop Glow Screen. And LTMD UV Clear. You know, they got the tall boy now. So how do I get rid of PIE on my face? Laser's your best option, but like you could do a 4 or 5% niacinamide serum.
Just got sniped from the straight ahead.
Okay.
Broke shields on him.
Is he back in the same spot? Like up here? Oh. No, he's on the big building. Damn.
Have a napalm bomb. One of a bunker blows through.
Okay. Did you just pop it or no? I cracked
Where is
him. I cracked him. He's here. He's on that mid level. That's why I was looking on the roof. He's beaming me. What moisturizer do I recommend with tretinoin? I usually just do CeraVe moisturizing lotion. There's also one straight ahead 255. Cracked him. He's here.
Good mark. Oh.
I'm gonna have to switch it up because he's gonna come back for me. What's best for psoriasis? So Raphael, we're on somebody's mission, by the way. There's a secure thing down here. Or like a
Broke shields on him. Downed him.
nice. Over on
Hitting with napalm.
you got that bunker buster still?
I got napalm on him.
Oh.
Didn't do anything.
He's up top.
Crazy.
He's up top on the big building. That is crazy. Do I recommend medical school or CMA school? Those are wildly different career paths. It just depends. I mean, if you want to lock in and grind, medical school, you know, but the difference between CMA and a physician is very different. I actually started out as being
Broke shields again.
a nurse, and then I ended up going to medical school. So what's best for psoriasis? So biologic medicines are best for psoriasis. I use a ton of Taltz, Cosentyx, Skyrizi. These are all great.
Guys behind, guys behind.
Okay. These are all fantastic options. Over the counter, there's not a ton you can do for psoriasis. A little bit of natural sunlight tends to help. But there's not a lot you can do like over the counter to kind of
He's behind here.
just moisturization. You can get like tar shampoos and stuff like that. It can help. Just your mild topical steroids like hydrocortisone. Good SPF for overall performance. I mean, anything that's like SPF 50 or greater is going to do a really good job. But like one of my favorite go-tos is LTMD UV clear. Beef tallow, I'm not about it. Treatments looking to for cranial hyperhidrosis. Some people do well with Botox up there, but your options are more limited. Crepey under eye skin. I really like retinol eye serums. I also like laser. Nizoral shampoo is great. One of my favorites.
Should I grab UAV?
Yeah, we can, yeah. Been on trap for years, no difference. If your skin is looking the same year over year, that's actually a wonderful thing in general. And it's not making a difference in your acne though. Sometimes you need actual hormonal directed like therapies like spironolactone, things like that. Best thing for severe eczema is Dupixent. Is both Botox worth it in your early 20s? I think the preventative.
Depends if you have really deep lines, you
There you
know.
go. Yeah,
If you don't have lines, then don't waste your money on it yet.
I think that's a good point. You start to notice like etched in lines starting to form and stuff. It's a good way to like prevent. But
I'm orange.
we're going into the darkness here, bro.
Yeah, I'm going here. Got a PA.
Having pimples behind the earlobe that pop and smell. So what those actually are is epidermal occlusion cysts. Try Cosentyx for psoriasis, but it's so expensive. Yeah, you'll have to look at like patient assistance programs, look at different options. There's usually a lot of ways to get these things covered.
Ricky, there's another guy here. Be careful. I killed one of them, but
Thank you. Flakes on the eyebrows. So that's seborrheic dermatitis. It's like kind of like dandruff for the face. And a lot of times what we'll do is, I personally, what do you got to go to on sebderm face?
I really like Zoriv.
Is it really? Okay. You're using that a lot?
Yeah, I use that a lot actually, because I feel like keto, for some reason, I don't know, the cooler has not been funny. And it is.
So, I don't know if it's you guys, you're cutting out a little bit, Chris, but all right. Test.
Do you hear me?
Well, dude, I barely, my like, my thing is like kind of messed up. Hold on a second.
Just be careful.
Test. No.
Yep. Gas on you,
I
gas
can
on you,
kind
gas
of-
on you.
Yes, on me. That was a weirdest
I hear you
situation.
good.
Here.
I don't know why it's changed. You wanna cross now? Vibe? That's bridge.
I think I might. Test. Can you guys hear me now? Chris, are you good?
I hear you.
Okay. Sorry, guys, about the trouble. I don't know what's going on with my mic.
Should we cross this
Yeah, I'm ready.
chasm?
Ready to cross the chasm.
Chasm. All right, fine. Let's roll.
Thank you guys so much. Sorry about the trouble, guys. Noob problems over here. How to clear acne, like 4 or 5% benzoyl peroxide in the morning and adapalene at night, but it's not really that easy. It takes a few months of doing that, and sometimes people need prescription treatments. Sometimes real stubborn acne needs treatments like Accutane.
Take right here.
Yep, we're taking them. Waiting for them to come out the top. We blast them. Absolutely cannot get rid of folliculitis. Common treatments, you know, doxycycline, clindamycin lotion, benzoyl peroxide cleanser, CLN cleanser. These are all good options. I have plenty of people that are athletes and plenty of people that work out that take Accutane and do just fine with it. So it just all depends. I mean, your dermatologist is going to watch you closely and make sure everything's like going smoothly. Oh, truck here. Just got domed from far.
Where?
I don't know. Don't get me. Don't get me. I don't know if it's safe. I got a self. Let me just get back and.
No, just
Yeah, I'll just start
yeah.
it. I'll start it. I just want to get under this hill. I think I'm okay. Thanks, bro. Do you use finasteride daily? Most of the time, yes. There are some people that take it kind of like intermittently. But
What the hell did you get domed from though?
it was somewhere like over 285-ish. Girlfriend can't get rid of dermatitis on the nose. So around the nose, between the eyebrows and that, it's a type of dermatitis called seborrheic dermatitis. And it tends to be chronic. It's kind of like dandruff of the face. It tends to be chronic. So stress can affect a lot of different skin conditions. Acne, rosacea. Oh yeah.
Guy on top
Cracked
too.
one on top. Cracked one.
Another guy over here.
Cracked one in the doorway on top.
Downed him. Damn, I downed him
That
all
was
the way from there.
crazy. Oh, you're shooting two different people. That was a long shot.
Yeah.
Damn.
Coming up the stairs right here. Found him.
Oh. Why?
Oh, we should move.
All right.
Let's go hit here where they bought.
All right. So Liam Bimzelix, I've got one gal on it doing really well. It's a good treatment overall. Everything I'm hearing about so far is very good. Julie, thanks for the follow. Thank you.
Sniped. I'm fucked. I'm dead. Yeah, stay low.
Oh, they're coming.
Thermite, if you need it. Just play it safe.
So they're going to the buy. Should I play it safe or should I try to take him out on the buy?
No, there's a guy in that thing. He's gonna snipe you. Be careful.
Damn. I blame this on you, Chris.
I just go buy. You have 13,000.
All right. Am I safe?
If you
tell me I'm safe.
You just don't go
See
there.
that?
There's a guy aiming from there. There's a guy in the
See
thing
that
you're
guy?
shooting us.
See that guy?
You're killing me. What was that jump?
That was stealthy is what it was.
Alright, do I go to my Lodi? I might tell you to stay by that buy for a
no,
second.
I'm dead. You're safe. Easy. Thank you. Just tell me I'm safe, please, dude. Nah, I roasted one of them. The other one got me. Is Anua a good brand? It's super hyped. Have you used any of the newest stuff, really?
No.
I highly recommend Tret. Highly. You always got to be careful.
Where was that guy?
He was at the buy. He got me right on the buy. Accutane is it's the best thing there is for acne. The only thing that can cure acne permanently. Is Epiclis better than Dupixent? I actually have not used Epiclis yet. Dupixent's so good and so proven though that I love it. Chemical peel or laser for acne scars, it all depends on but most of the time laser. There are some really aggressive chemical peels that can be done too. CeraVe is a great brand overall for a vast majority of people. I know you said it broke you out last time. I mean, sometimes that's like not every single product works for every person, but in general, you're getting glinted too. Careful. All that should have hit. Altrino versus Retin-A. Most of the time, I use like retin-A or tretinoin for people, but oh, that was beautiful. That's rough. So someone said I can't stop picking their face. They're doing bacitracin and neosporin face masks. I don't know. You got this, Chris. The cure for acne is no sugar. The cure for this team is about to be Chris Tomasian. Cure them, Chris. Cure them, dude.
I got nervous. I got nervous.
I know. There was a lot of pressure. You had all those people watching you. At least I did some damage that time.
You did. You did some work.
I did some work. Is esthetician good hours? I mean, I think those are pretty like chill life, dude. Esthetician, I think that's a real chill life.
My esthetician works normal hours.
Normal hours.
Likes it.
Yeah.
It likes it.
Yeah, yeah. I'm gonna run to the restroom, Chris. I don't know if you wanna talk to the chat for a moment.
I mean, I don't know what they're asking. Let me get on. Let me get on my phone. I'll see what they're asking.
All right. Be back, guys. Be back.
Here. What's up, everybody? Hey, I have tightness on my eyelids towards my nose. What can I do? Some kind of dermatitis before. I would use even just like a 1% hydrocortisone for a couple days. It should help. What's up, late night design? Let's go, guys. Itchy skin once I get out of the shower. Sometimes I could itch for no reason. What I would recommend, you moisturize right out of the shower, because like while you're still damp, get a moisturizer. Honestly, put it in the fridge. Put it on right after the shower. It'll cut that itch out pretty fast. This kind of bad eczema of the hands. Dupixent works really well. Opsilura works well. Topical steroids, Kiehl's hand salve, Neutrogena hand cream, all really good ones. Medicube toner pads are pretty good. No, thank God Dylan's back.
I'm back. This is stressful. He's freaking out.
Take it over. Take it over, man.
Is being an esthetician good clinical hours for medical school?
No.
No, I don't know about that. Have I ever heard of Henry Sheen? I'm a sales rep in LA. Of course I have. I feel like so many people buy from Henry Sheen, but it's a little pricey though.
I lose. Yeah, it's killing my margins.
Really, single-handedly destroying your practice.
My margins are.
Yeah. Yeah, no, I heard. Dawson Levy. You guys are awesome. Thank you guys so much for being here. I appreciate you guys. I appreciate the follows. I will say, said you got to get your rep as your quote. The base catalog prices are way too high. Are you negotiating, Chris?
Dude, the problem is going through the rep is very difficult and honestly tedious.
Mm-hmm.
I'd rather not talk to anybody and just go through
Just go and order it. Yeah.
Yeah.
My skin fell off. Am I good? No, you're not good. That's bad. So bad.
You're cooked.
When it's cooked, the meat fell off the bone. I smoked the ops so hard the meat fell off the bone. Who said that on TikTok? I am hiring like my team needs one other person. I am employed dermatologist. LTMD, I love it. I love it so much. Got it here on standby, the tall boy on standby here in case we need it. So big fan of that. Stasis dermatitis. I love Vanicream. Stasis dermatitis, use compression socks for that. Sometimes you got to use topical steroids for it. Keep the Neosporin and that kind of stuff off of it. The derm desk, I'm not in LA, but Dr. Tomasian is out in California. Cheap brands for like teens. I mean, just CeraVe, you know, get a good moisturizer, get a good sunscreen. That's kind of a great place to start, right? Oh no, I'm sorry, Callie. Oh, I missed what it said. What can I do for 10 anniversary? Yeah, to Callie. Yeah, it's hard out there. Hey, much easier to chat here. Thanks, Nank, for coming over. Is there a cure for psoriasis? So there's not a cure for psoriasis, unfortunately. There's the best treatments we've ever had, heard, or best treatments we've ever had for psoriasis. A lot of times people get 100% clear, but there's no cure for it yet. So even the best treatments you have to stay on. Now, some of those treatments you only have to do like every 3 months, which is pretty freaking awesome, you know. Eczema worse during the summer. You know, it could be an allergen thing. You know, I feel like sometimes the heat and the sweat and just airborne allergens maybe can. Are we going underneath?
Yeah, buddy.
Okay.
No. First place. We're going right here. Okay.
Okay. Yeah.
Don't get crazy over that side. Okay.
The Dr. Christopher Tomasian in Glendora. Chat's asking. Chris, is that you?
Yeah, that is me.
Okay, that's him.
That's word on the street.
Hey, that's me. What can I do for tinea versicolor? Selsun Blue shampoo is a body wash. Ketoconazole shampoo is a body wash. You can also get a great body wash called SwoleMD. Actually, one of my chiefs.
Or take etraconazole for 1 week.
Yeah, you can take oral etraconazole for 1 week. What kind of dosing do you do for that, Chris?
Here? 200 daily.
200 daily.
Week.
This is SwoleMD. This is the body wash I like. But yeah, I have these thin patches on my elbows and smaller spots on my legs. It's more annoying than anything. I think that's the nature of psoriasis. Sometimes it itches, but a lot of times it's just kind of like real annoying. And you know, the topical steroids are going to be the main treatment for it. But if it's bad enough and it's affecting your life, you know, doing things like injectable biologics can help. I breakouts all over the chest from wearing a gold-plated necklace, so you're allergic. You know,
I guess you can only have diamonds from now on.
Diamonds, yeah. Better switch it up. Gonna have to get you real gold necklaces, no alloys. Diamonds. Get you that Cuban link. Iced out. Iced out. So, for real though, it's allergic contact dermatitis. Nickel allergy is the most common allergen worldwide. And in the United States, the most common allergen is poison ivy. So really your best bet with that is just topical steroids. So like hydrocortisone. A lot of times, of course, if people come see us, depending on how bothersome it is, we might even do like an oral steroid. You know, we might do a very strong topical steroid. But
yeah, oral steroid, 3-week taper, boom,
done. It's behind you and you're good.
It's behind you.
It's behind you. Now, if you come in...
Fun fact, if anyone wants to take a gander at the money situation, Dr. Tomasian, again, is carrying the team. Yeah.
So 18,000 versus 2,200. Now, will he carry right now, though?
They're right above us.
Balding at 17, should I take finasteride? You may be able to delay your hair loss some. I do have some young people on finasteride. It is a very proven treatment. Can't say it will keep your hair forever, but you know, if those
let's get out of
follicles are really, those follicles are really, you know, sensitive to the DHT, you know, it potentially can help. I've never had them diagnosed by dermatologists. Like, I have bumps and holes in the spots, very dry. The skin looks like grows super fast. I mean, if it's elbows and stuff, it most likely psoriasis, but obviously, you know, like you got a rash or something like that, better see a dermatologist. But this is a clinical diagnosis most of the time. It's not like it needs special testing. It's kind of like just hearing the story, seeing where it's at on the skin. That's a very common location for psoriasis. Is witch hazel good? Yes or no? Oh, damn. You think at the end of the day, is it worth it becoming a dermatologist, Chris?
here. Yes.
At the end of the day. Yeah, it's totally worth it.
I think if you want to be a doctor, it's worth it.
Yeah.
But I wouldn't do it because you think it's going to be like glamorous at all. I think a lot of it seems glamorous on social media, but that's definitely the minority. It's not the majority. Just like anything else, I think.
Mm-hmm. That's the nature of social media, right?
Yeah. I'm gonna go get us a load. I'm gonna get us a loading. I'm just gonna drop enough money for you up here. Okay.
What's a good face wash for black men? I would say just like I really love like CeraVe cream to foam cleanser. I think this is a really good option just in general. It lathers. It you know, you feel very clean. It doesn't strip your skin. I think it's a great treatment. Stop flaking on the beard and head. Again, your anti-dandruff shampoos, you could also double those up and use them as a face wash. Does losing weight stop eczema? Not really. And I don't believe that like really obesity is super tied to eczema, where it is some other conditions like HS and acanthosis nigricans and things like that. Cracked one, but he also cracked me. Are you hiring, Dr. Tomasian?
No, not right now. We have a pretty stacked team.
No, he's got a stacked team at the moment. Got somebody out in LA they're like looking for a gig.
Coming to you.
Cracked him again. My step 2 score, I got a 264.
Damn,
son. I feel like I got
nerd.
I got lucky, dude. I spent some time studying. Does gut health worsen eczema? So it's definitely a pretty like highly studied topic. And a lot of people do feel like there's, you know, probably a link to the microbiome and gut health. You coming back to me?
Mm-hmm.
We got zipped at from somebody. Do antidepressants cause acne? I generally don't think so. What's the root cause of psoriasis, Chris? Would you say the root cause?
I think like 35-40% is just genetic, like mutations, and then environmental things that trigger germline mutations probably cause it.
Yeah. Ultimately, I think it's like intercellular signaling.
They're doing some shit. They're doing some shit under here. They're just buying here.
Yeah, they did. Or wait, that's the drop. I don't know why that pop is. Oh, they're running a mission right now. Also, watch out because I think there are snipers. They're running that like secure or something right now. I've cut out 95% of sugars, no sodas, limited dairy. It doesn't seem to help much. Yeah, so like kind of like Chris is saying, there's some over here. Down one.
Finished.
Nice.
Little bitch.
Nice. Damn. Easy. Now there's children. There's children.
Oh, I'm sorry.
just kidding. I just kidding. It's okay. It's okay. You shoot the corpse.
No, there's another guy up there. He's trying to play a hero.
No heroes here. Don't be a hero, son. Let's see.
I killed your friend on purpose.
Yeah. He really does this shit. He's back.
Oh.
He's back. He went all the way down, didn't he?
I think.
He's over
Yeah,
here
I don't
now.
think he was supposed to land there. I'm not gonna lie.
He pushed me.
Whoa, 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 whoa. Oh shit.
Yeah.
Other side, other side, other side,
Yeah,
other side.
I see him. I see him. I see him. I'm gonna down him right here, right now. Everybody pray.
Down him. I'm getting shot from both sides. Jesus Christ. It's Jason Bourne. Do you have an armor box? No, you don't.
I
Thank
know.
God.
I got a wall though.
Oh, thank God.
I got a wall. We're ready. Let's see. What's a good shampoo for psoriasis? Neutrogena T gel, you know, is good. I think that's a good one. Gel shampoos. There's another DHS tar shampoo. That's another good one. Any tips for HS? That was from who was it? Misery. It's something that you definitely need to, you know, actually see a dermatologist about. You're not going to be able to do a whole lot from the perspective of, from a perspective of like home treatments for HS. It really requires more. You know, it's a thing where you're going to need prescription.
Oh shit! I'm dead. I'm dead. I'm dead. Oh,
that wall would have came in handy there. They're flying on me. They flew on me.
Well, they can't reach you.
They flew over here though. That guy's white. He flew over white? What? How do you live? That's crazy. He left the building white. No armor.
Damn.
It's actually really rare.
We're going now.
Okay. So the crazy thing was, Chris, I flew to their building and I shot them through the window they shot you at. It was like a crazy play, bro. I'm still doing
Wait,
this.
so are they?
They're at our building and I'm shooting them through the window they killed you at.
Loadout is safe, right?
Loadout, yeah, loadout should be
Below
pretty
you.
well safe, bro. Loadout's pretty safe, bro. They're like looking at me hard though, dude.
They're thirsty. What do you want?
They're so thirsty, bro.
Dogs gotta eat. Dogs gotta eat.
Yeah. They want that kibble. They want that wet food. I want a little gravy on it. Yeah, a little gravy, dude. So play BF6. You know damn well BF6
guys,
is not
guys,
available
on
on us. Does baby Vaseline actually help with psoriasis on the skin? It can make it feel more comfortable overall.
clinic. I'm putting clinics out, okay?
I heard the team wipe, dude. There's enemies here. Down one. He's still up though. Buddy's sliding to him. Down him again. They must have a self revive.
He's going for that buy, I think.
Are you knowledgeable about Mohs surgery? I'm fairly knowledgeable about Mohs surgery. I don't perform it, but I know about it. Best treatments for keratosis pilaris on the arms. I would say
Remedy for body bumps.
remedy for body bumps is a very good option. And another good one would be like a CeraVe SA lotion. I've always had these spots. Only within the last 10 years it has appeared and gotten worse. So yeah, that's the nature of psoriasis. A lot of times it's going to show up, you know, between like around age 30 and 60. Sometimes people have perfectly normal skin and then it kind of pops up. So that's...
Should we move now so we don't get killed?
Yeah. Ready?
Okay.
Ready?
trying to think which way should we hit, like over there first
we
or
gotta
not?
we gotta get across the gully. Yeah.
Alright.
I don't know. We can go to port. You can try to make it to the edge of port or something.
All right, ready?
Yep.
Oh, there's team.
They down there. Oh, they're getting glinted. I'm getting glinted. I'm cutting to the right a little bit. I'm still going. I'm cutting over. So yeah, a lot of people don't have psoriasis problems until later, you know. Link between Ehlers-Danlos and KP. I'm actually not. I don't know that there's a link. Beef tallow good for psoriasis. Not any better than like a moisturizer would be. You know, did you make it over here?
I downed both of them.
What?
And they're rezzing it. I'm coming now.
I'm looking back at it a little. Oh wow, you got him down with another strike.
I got one.
Should we push that then? I mean, we can take him, right? You want me to put a drone up?
What the fuck? What the fuck? Sorry
No,
for my language,
you're
guys.
good, you're good.
I need you to put some cover
Here they
fire
are,
or
here they are,
something.
here they are, here they are. They're moving. Jeez. Oh, got him down. How'd I get a
Nothing to put him
collateral?
down.
How'd I get a collateral? That collateral means that I killed him and he killed me.
They're gonna have to keep moving towards us, so.
Yeah.
He's moving right of you. It's in the mountains.
Up here. Hear him snapping, bro.
Watch.
Got one white in the gas. I only have one HDR bullet. They're up high.
I'm in.
They're high
Alright.
up here. Oh man, I'm in the middle of a field. You hit 2 and 1. Oh, dude, that was sick. Yeah, and I did that blind, by the way. You saw that? I just shot into the gas. They're here now. And then there's a vehicle over here. Oh, nice. Oh, that was savage, dude. Nice. Was that the guy that was popping at me?
No, no, that was the guy by the car. I don't know what the hell.
Love it. If anything's been on the... Do you need a mod? I can help pin comments. Cynthia, I would say if I see in the lives pretty regularly, consider making you a mod. We got a couple mods. They're not on tonight or right now. I mean, got one close. White, Thurston.
Underneath it, right here. Right next to you. Be careful.
Yep. Yeah, he's white. He's white.
I can't see him.
Missed him with the thermite.
I got him.
Take him. I got him. Don't worry.
Oh shit.
I'll handle this.
Shit. Can you come get me?
Yeah, for sure. What's the quickest
Can
way
I
out?
fall on you?
I'd try. Trust.
Yeah?
Trust.
Alright, I'm coming down. Ready?
Trust. Yep. Trust. That was beautiful. We did it, bro. Beautiful. I'm gonna take this HDR because I have no ammo. I still have no ammo. You got an ammo box?
Yeah, I do.
Oh, he got ammo in this one.
Dropping.
Oh, yes. That's what I needed. That was actually insane, right?
Yeah, that was
Someone said,
OG. That
or
was
Randy
awesome.
said, I'm swooning over here. That was so good.
Should we get a car and move to prison like yesterday? What's the way?
Yeah. Should we play that back way like that one time we got that dub?
Yeah.
Just in case it ends up over there. Wait, do we need a car?
We might not, but sometimes when you don't have a car,
Then
I
you
mean,
wish you had
it's
it.
like
But the problem is,
I'm just worried that we'll get run over by someone's car.
yeah, I mean that's true.
Was that you?
I flew, yeah.
Okay. I got this car right here, right? Yeah.
I saw one flying over here. Mohs is definitely competitive. Yeah, I mean, you've got the top dermatology candidates applying for Mohs. Coming to you. I'm in. Thanks for the follow, guys. Appreciate you guys. It's been a great live. Appreciate you guys. Shot to her right. How do I get rid of poison ivy? You know, usually topical steroids, oral steroids, and they usually need to be tapered over longer than a typical doctor will give you. Like sometimes that can continue to flare and aggravate for a couple, 2-3 weeks. So that's the hard part. What causes acne? Pore blockage, bacteria, metabolism of skin oils, which cause inflammation. I do have a drone. So there's 3 right above us in the castle, directly above us. I don't have anything lighting up. Oh yeah, there are 2 coming down the coastline on green.
Oh fuck, I'm going there. I'm going there.
The tower too, we gotta watch out for because they're gonna
Can
be.
you mark the coastline? Mark the coastline. Cause
Oh well, this is where they're at. I mean,
I see him. 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 Get low. Get low.
Find somebody.
Guy right here.
Yep. Got him.
Oh.
Yep.
Low. 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 Low.
Oh.
Oh. Grenade on me. Grenade on me. I should have.
No, bro. You got low. Why did I grab this shitty ass gun? Oh my god, I left my good gun.
Go close. Yeah, go close. Go into the gulag, or yeah, underneath
Where's
gulag.
the
maybe.
hole?
Right here, straight, and then to the right.
Is it on the hill? Should I run this guy over?
It's. Oh, kill this guy. Good.
Oh.
Oh, not even.
Didn't
see
expect that. I didn't expect that, boys. But, you know, yeah, TikTok, this is the first time I've actually done horizontal. They've had it for a long time, but in the past when I tried to do it, it was kind of bad. Because it felt like it just like really, the views were horrible when I do like horizontal and vertical. So if you guys are on your phones and you want to turn your phone to the side, you can actually get a horizontal like stream, which is pretty cool. So Austin said, how do I start diminishing stubborn acne spots on my temples near the hairline and forehead? I've eliminated wearing a hat. What routine can I try? I'm using CeraVe cleanser moisturizer. So what you want, Austin, is you want to, you know, CeraVe is a good product line, but you want to have active acne treatments. So what I would say is either, you know, if you have more like blackheads and whiteheads, then use the CeraVe acne control cleanser, which is salicylic acid based. If you have more like inflammatory pus bump type acne, then I would use their benzoyl peroxide wash. And then at nighttime, I'd use La Roche-Posay Effaclar Adapalene gel. Kind of do that. So thank you guys so much. Geology skincare. I don't think I've ever used that. How to best position myself for dermatology and med school. Great grades, you know, be a personable, you know, person, be, you know, you want to do some degree of networking, ideally. It's a little bit of, you know, a little bit of research. It's just always a red flag. Like if you have nothing, you know, if like you don't have any research, or, you know, you want to get good scores, definitely where you're able to honor your courses, AOA if you can, you know, those kind of things. Tightness on my eyelids, it's been like that for a week. I had dermatitis around the eyes. Esthetician career isn't good enough. I mean, I guess you know, it's all how you spin things, right? It's all how you can talk about that experience, what you learned, what you gained for it, maybe why you wanted to do something different or more, you know? So like all of those things are important. Are there risks to taking injections for plaque psoriasis? There can be. So plaque psoriasis, you know, like some of the injections, you know, they do affect your immune system some. Some of them have increased risk of like blood related cancers like lymphoma, you know, infections, injection site reaction, things like that. Is CeraVe good? Yes, CeraVe is very good.
CeraVe is good.
It's good. It's good, I would say. We love CeraVe. We absolutely do. What can cause tightness on the eyelids towards the nose? Well, I think if you were asking the question,
Eczema.
I think eczema. There you go. Eczema potentially can. What helps with hair loss? Minoxidil. You can get 5% over the counter, but you can also take it orally, or you know, you can do other treatments like that. Thoughts on Proactive? I feel like the ingredient profile Proactive has gotten better with time, right? Because I think nowadays it's kind of like in line with a lot of the stuff.
I'm gonna get us to 10K likes right now.
Okay, you're gonna tap it up. Tap up the screen, guys.
Do you see those?
Doctor,
do you see those taps?
let me see. I see a couple hearts rolling in. I appreciate it. Would I say derm and endocrinology are similar specialties? No, they're not really at all the same. They're completely different. And definitely derm is obviously way more procedural based, which is maybe one of the biggest differences. Both of them, SJS versus TEN, how do you tell? Basically just percent body surface area involvement. How to get rid of tinea versicolor. This has been a common question tonight. Who's winning the World Series? Brother, I don't even know who's in the World Series. Is it even baseball season? You know what I mean? Are the Cubs in it? I doubt it. Are the Cardinals in it? If the Cardinals are in it, I think they'll win it. If they're in it. But doesn't derm guards are getting crushed? Oh, okay. Well, I mean, the cards are getting crushed. That's rough then. Well, I hate to hear that. I didn't know you were a baseball fan, by the way. Beef tallow good for acne? No.
Bro, I'm almost there. I'm at 9.6K.
Bump it up. 9,500. Let's keep tapping that screen. Tap that screen. Baseball and hockey all the way. Oh, very good. Nice, man.
Where are we going?
We need to go up to... Hey, Loves. You doing okay? Let's anywhere. Drop it. Is little man awake? He's awake? Okay. This is probably last call, Chris. Your last call, though. You hungry? Baby, man.
I like slept too.
Oh, that's good. You slept. Make sure that hog doesn't start to get them colds. No, I love you. We've had a real good. So does everything look good on stream, love? That's good. Love you, baby. Do you perform keloid removal on the arm? I do. A lot of times you can just inject them. Sometimes I do laser assisted delivery of drugs like Affidex and Kinalog. Other things I do is sometimes you like actually cut them out and stitch them up and then like mindfully watch the scar formation, like, and do injections along the way. Those are all like good ways to kind of treat. I keep getting tinea ocuris. Yeah, it's really hard. I think Dr. Tomasian earlier brought up a really good point. Like sometimes treating your feet too can be key, because sometimes like pulling your underwear up over your feet and kind of self-inoculating the tinea back to your groin can be a problem. What's my opinion on Accutane? Accutane is the the best medicine there is for acne and the only thing that can cure acne permanently.
This might be controversial, but if you go to a dermatologist, are you mad that I'm saying it's controversial?
No. I'm excited. I'm excited.
If you go to a dermatologist who scares you about Accutane, they're not a good dermatologist.
I think that's pretty much true. Yeah.
Like,
I mean, I'm always like, people come in and if they got like some scarring or if they like at least tried, you know, some tretinoin and stuff, I'd rather get them better, man, and put it behind them so they can get on with their life.
that's what I'm saying.
And I've had one person I've taken off Accutane for legitimate issue, and he very well could have had that problem on his own. You know what I mean?
Yeah. All right, I'm dropping money on the buy.
Okay. A rash and you were prescribed prednisone and it had no effect. It's like rare, you know, honestly, most things respond to steroids, even if it's infectious. It tends to look better temporarily, you know, but that's the reason why you have dermatologists. You know, you got to go back, and sometimes you do have to come back with fresh eyes, do a biopsy, try something different. That's why we do follow-up. You know, it's pretty rare for us to just be like, see you and say, hey, we're out, you know. Type 1, thanks for the follow. I appreciate you. Opsilor for vitiligo. I've had some good luck with it, for sure.
Where should we go? Oh, they got loaded up front. Let's go get them.
Okay. Where are they at? At our buy? No.
No, up front, like higher up.
Okay. Dermatomyositis can barely walk. Her next appointment is March. Will she deteriorate? In March? So she has no treatment? I mean, I would just like look.
Prednisone.
Yeah, it can't be treated. You can shut it down with prednisone. You do other treatments, but I mean, in the end of the day, that's something where it's going to be probably worth traveling, you know, try to find out, call around, check with like your local academic facilities, you know, and kind of see if you can get in with maybe another dermatologist or another rheumatologist a little sooner. Thank you guys so much. I appreciate the 11K taps.
Damn.
Yeah. How do you guys like the horizontal? If you're vertical and you're on your phone, turn that sideways, you get a horizontal stream. Tell me which one you like better. Horizontal or vertical in the chat. Witch hazel, is it good for post-shave irritation? I don't think in particular. I don't think it's particularly great. Nice shot, bro. Wow. You get that advantage up there, Roy. Anything you suggest to deal with vitiligo? I use a lot of topical steroids for vitiligo. You can use narrowband UVB. You know, you can do the topical JAK inhibitors. Horizontal, Norman, thanks for the follow, and glad to hear your feedback on that. Black streak through the nail, you know, honestly, if you have one on just one nail, especially if it shows darkening of the skin too, that can be very alarming, and it's always good to get that evaluated. Sometimes people with more pigmented skin can have multiple lines in the nail. That's called longitudinal melanonychia. It can be caused from medicines too. And so good idea to get checked out, especially if it's something new for you. Post-shave irritation, what do you recommend for it? Do you got any good ones for that, Chris? I know you got the...
I mean, honestly, I tell people just pick up 1% hydrocortisone.
Really?
If you're not shaving like all the time, it's not bad to use it here and there, but
yeah.
You know, I wouldn't use it every day for sure, but
yeah. It's a little bit of
Once
just,
a week, I don't think it's gonna do anything.
yeah, just to drop a little bit of that.
Right here, right here.
Missed my opportunity. I blew it. Oh wait,
There's another one closer, I think. Just be careful.
he was coming this way and then he circled back. Who's best for derm versus endo? I mean, it's hard because you have people with all different kind of personalities and different
I
specialties.
might move here. This is not a
Okay.
great place
I
to
like
be.
it. Yeah, there's not much here. I'm gonna fly. Ready? They're shooting us. They're on the left back end of the house.
Damn.
Where's he at?
I don't know. I got zapped though when I went up there. Don't go up on top. Right here.
Falling back. Does glycolic acid help scalp psoriasis? Sometimes it's formulated in.
Slightly.
Yeah, a little bit. It can help like loosen up some of the dry, dead skin and make the scales less obvious, but it's not like a core ingredient, but it can be helpful. It can kind of break the bonds between skin cells that like let that thickening occur. I was going for the loadout. Wow. I wish I would have waited until
Growth shields.
the buddy's there too. Cracked him.
Growth shields. Wow.
Yeah, man.
That's crazy.
What month do people see the most improvement on Accutane? I
4.
think
It's usually when it kicks in really well.
Four. I was gonna say 3 or 4. Yeah, I think I like. Yeah, sometimes I tell people like the last 2 months is like when they really like love it.
They don't. Yeah, you shouldn't break out for the last 2 months. So
Yeah, should be clear.
no
Ideally a
pimple
month
for
or
2
2.
months is kind of wild.
Yeah.
You know?
What did it say? Someone said. I'm trying to see. Economy so bad we got doctors streaming. Dude, I'll tell you what, man. I went and bought 2 things of body wash today. And it was $18, dude, for Dove body wash.
Nah, shit's expensive now. I'm not
So
gonna lie.
expensive, bro.
I got kind of like, you get a little jaded because we get a lot of stuff sent to us.
Yeah,
Things are expensive.
it's really expensive, yeah. Good method to remove old acne scars. There absolutely are. It's never a one and done thing, but you know, different types of procedural aspects with your cosmetic dermatologist can help. Microneedling, peels, lasers, any of these things can help. Help with hidradenitis suppurativa. You got to see a dermatologist. There's not going to be a lot you can do over the counter. The one thing you'd probably want to start would be doing like CLN shampoo, or sorry, body wash, and at least decrease some of that inflammatory bacteria on the skin. But it's a challenging condition. Probably literally one of the top 3 probably hardest things to treat. Is there any way to get rid of the black streaks on the nail? Most likely
No.
not, to be honest. Yeah.
Unless you remove the nail.
Yeah, I mean, even with that, I mean, is it gonna go away? Is it gonna grow
I mean,
back?
if you kill the nail matrix.
Oh, you mean like phenol the nail?
Emulsion.
Yeah.
Uh,
Is Bubble a good skincare brand? I think it's a fun brand. It's fairly affordable, you know. They make some good stuff, you know. I think it's fun packaging. Thoughts on Accutane? Accutane is the best medicine there is for acne and the only thing that can cure acne permanently.
I just wanted to grab that
Yeah,
price.
I
I don't
just
think we
need
need to
that.
go there, but
Okay.
guy landed right here.
Okay. Is it possible to fully remove scars and keloids? I mean, it's never going to look like perfect, normal, healthy skin, no. But you can usually improve it. But even with that, sometimes you can go through and do like a perfect job doing like a procedure or
Growth shield
surgery.
on. Oh shit. Shield's back. Downed him.
Nice job.
I don't know if you're.
Should I rush
no,
it?
you're not near there. No, I thought you were there. Sorry.
No, it's okay. Thoughts on Medicube. Medicube is one of my favorite Korean skincare brands. It's a great brand. Some of their face masks are very good. Love them.
What do you think about their the devices?
Devices I like. I mean, I'm always, like I always say, I'm really bad about using the devices like regularly. But I think their Booster Pro, like for somebody who's like a skincare fanatic, I like it. I know they do like a lot of their own internal research, but I can see the little tingles and zaps of the skin kind of increasing some of the blood flow to the skin and increasing, you know, potentially product absorption. But
Damn, back to the same one, huh?
TV station. Is there a way to fix greenish gums in one part?
Nah, wrong doctor.
I don't. Yeah, that's dentist stuff, and I don't even know what that would be caused by. You know, he's at TV station, right?
Yep.
There's no cure for vitiligo, unfortunately. And sometimes it does kind of fizzle and like can like improve on its own. Same thing with alopecia areata.
All right, let's get in that car and go back to where we are.
Oh man, I hate to hear that about the Ycanth. Have you seen some of these like things about Ycanth and like severely burning kids?
What's that?
It's like that. It's like the here I'm coming to you. So it's that really fancy packaged cantharidin, and I've actually used it on some.
The guy to the right, by the way.
Okay,
Sorry.
I've actually used it on a few kids.
You want to kill him?
Yep. I'm ready.
Oh fuck! Get out! Get out! Get out!
You okay?
Yeah, I just don't want to die to that thermite.
You cracked one.
I got him.
Did you? Oh yes.
Idiot.
So cracked the other one. So I have bad news. That was my thermite.
Are you kidding me?
I'm not kidding you. That was my thermite, and that was really cool that we got that guy, though. I will say.
Where's his friend?
So.
Where did the friend go?
Jelly bean. Jelly bean. Friend was behind that marker there, but I don't know where he went. So he probably is running to the buy, right?
Why would you get off the thing though?
Because I domed him. No, actually, no. Why did he get off the thing? But he didn't buy. So there's somebody.
Shields. That guy has shields back there if you needed them.
Oh, here, I got movement here, right here.
Yep.
Oh, nice.
Where's the friend? Where's our friend?
I didn't see a friend yet, but
Oh, just got hit.
Was that behind? So I think Steven Johnson syndrome is not always fatal, no. But you do have to watch those people pretty dang close because they can get infected, can have kidney failure, all kinds of badness. I got movement, 250 or 350, 350. This way. I think. Wait.
Shit, we're still in gas, aren't we?
Yeah. Do you need to buy anything over here?
Yeah, I'm just gonna grab a precision.
I got a muni, but I got a precision too. So somebody, I think they were saying like, somebody was asking like dark skin, and then someone was like a caps lock in the chat, like answer the question about dark skin. So I didn't get the actual question, but if you have dark skin, like a neck, underarms, elbows, could be something called acanthosis nigricans, and your best bet is just using amlactin regularly to kind of thin out some of that thickened up skin And just make sure you're exercising, you're eating good diet, keeping your insulin, staying insulin sensitive, because insulin's a growth factor and it can thicken your skin up and cause a dark skin. If you're having just dark spots on the skin, then I would try Remedy for dark spots. And it's a great serum that can be helpful for fading dark marks. It got about 9 active hyperpigmentation fighting ingredients in it. They were asking about skin color. So nothing you do. Okay. Somebody here.
I'm gonna move straight ahead. Okay.
Wait, hold on.
We can move to this.
All right. I'm ready.
Or actually, let's go here.
Okay.
Let's just closer on to.
Ready,
Oh,
ready.
guy in here. Guy
Yep,
in here.
okay.
I'm just gonna keep moving.
Okay, ready. He's looking at us, by the way. Now that guy.
Yeah.
Is
Should we go
Warzone?
top super? Top super.
Yeah, I
bounce?
love that. Is Warzone good for my skin?
Yeah,
I think as a
so good.
dermatologist, yeah, I'd say yeah. I think we both agree. That's probably like it's day one dermatology stuff. Like you read Habib,
I
maybe.
will tell you, Warzone is great for surgical skills because it works on hand-eye
Mhm.
coordination.
There's no doubt about it. People that play video games better at surgery. So, you know, you can count on us. I'll tell you that. Well, I'm getting zinged. I'm
Whoa.
getting zinged and zapped.
Yeah. Let's see from where.
I don't know.
Oh, right here.
Okay. Yep.
No shields on one.
Is expensive soap? So soap shouldn't be
No
expensive.
shields.
Man. This
They're
guy's
gonna be
he's in the
gas.
gas, yeah. I mean, I could throw some precision down in front of him. Cracked him. Almost popped it.
Oh fuck! Sniper straight ahead.
Yep.
Downed him.
Nice.
He's in gas too, so good.
How to get rid of fungal acne? I like SwoleMD bar soap.
Where should we go? Gotta think. Guys up here.
Him. Oh yeah.
So stupid of me. Oh no.
Really? We got the gas on us too, huh?
Yeah, I know.
No way.
No way.
No, I'm not. Am I fine? I don't think.
I'm got you. I precision them.
Thank you.
We're good right now.
Man, I don't know if I need to pop another one. Still got.
Keep moving. I'm gonna move into a gas station here.
Need
We need shields. Yep.
Yeah.
Was that your precision?
That was. Do you need to use filler and subcision, or is subcision enough? I mean,
Sometimes you need filler.
yeah, sometimes you gotta have both. Yeah.
But it's a different type of filler. I mean, we're not trying to. It's just underneath the skin. It's like kind of subdermal.
Gives you like a little strut. It's a little support, you know. Beef tallow, like I'm not like a believe. Are they both up there still?
Yeah. Just have nothing to down
To
them.
finish with.
Yeah. I'm gonna keep moving actually left.
Okay.
Here, cool. Let's keep moving here. Some shields or some shit.
Over here. Cracked one.
Where?
He's like over here. He went in the bottom level of that. See the map?
Oh, guys, yeah.
Dang, you going after it?
I'm just getting better positioning. I got PA here too.
You got one flying
Right
in?
here.
He's coming up. He's up. He's up. He fell
You got
off.
him?
He fell off now. But he's still here.
He's slowly might come up this side.
Yes.
Watch behind you too.
So Battlefield 6 beta is closed. I love Battlefield. And I would be rocking that. But I can't rock that right now because it's closed. I don't know much about Peel Shot.
We gotta move, we gotta move, we gotta move.
Okay.
Going this way.
Yep.
Guy here on us. Just come out, just come out. Behind.
There's the
Shit.
lock in chat. Scared, bro.
No way. Jesus.
Oh, in the grass, right outside. Are you leaving me? Oh. No. No. Oh, he did. He did. We needed to move though, because yeah, he had the C4s. Damn.
That was a good one too.
That was a very good one. That was a very good one. Well, let me wrap this real quick here. So I appreciate you guys. Thank you so much. Mom, I just saw you actually in the chat. Thanks so much. She said I'm quite awesome. So I love you so much, and appreciate you guys for hopping on here. We had a really good stream, so I really appreciate you guys. It's been a nice one with Dr. Tomasian. Appreciate it. You guys rock. Daisy, thanks for helping everybody else in the chat. I seen you guys in here like helping each other in the chat even when I wasn't able to read the questions. So thank you guys so much. I'm gonna go ahead and shut down the stream. If you guys didn't get your question answered, all you need to do is pop over to my most recent video. Hop over to my most recent video and I'll be able to help you over there. So just pop over to the most recent video, drop the question there, tap the follow if you guys don't already, and then I'll be on live again sometime soon. So make sure to follow so that way you get a notification in that. So I appreciate you guys, and I will talk to you guys all soon. So I'll see you soon, and thank you guys so much for your support today. All right, I'll see you guys. All right, let's see, shut that.